Hi, I'm Dr. Usry of All American Wellness Center. Today we're going to be doing diagnostic testing with the laser and going over different reflex points on the body. This is the way we evaluate nutritional status and visceral status. And we're all about function here, so what we're looking to see, are there any areas of dysfunction that maybe nutrition would be able to address and improve. So we use this laser. As you can see, there's a red and purple color to this light. This light is going to go into the body and evoke a stimulus. If the reflex point is normal, as we do the muscle test, we'll keep an intact muscle. If the visceral or energy point is not normal, is not functioning normally, then we will find that the muscle is not intact, and that gives us insight to where dysfunctions on a nutritional and visceral level may be occurring. So I'd ask you to hold your arm up if you would, Adriana. Don't let me push it down. Good. You feel it lock? Okay. So we're going to touch the liver point, the gallbladder point, the cystic duct, the heart, the spleen, the pancreas, and the stomach. I'm going to look at the small intestine, the large intestine, and all of that is showing up as normal function. The muscle locks each and every time we spray the laser on these points. We're looking at the bladder. Hold up. And we see there's a problem in the bladder. We look at the ovaries. We look at the uterus. We look at the adrenal gland, the thyroid, the pituitary pineal, the entire endocrine system. We check for infections, for parasites, for viruses, for funguses, for bacterias. And right here we see a bacterial problem. Hold for me. And we check here. Nothing. We check the toxic point. And again, we see certain problems. Many women can develop bacterial infections in the vaginal area, in the bladder, in the kidneys. It's a very common thing we see in our office. And we use homeopathy or herbs to treat this problem. And this is what we'll be doing with this patient. We'll be evaluating certain herbs to attack the bacteria and stimulate the body's immune system so that this doesn't become a big symptom problem for the patient. Again, this patient may or may not be aware that they have an infection. A lot of times we're able to find certain problems that the patient may have slight symptoms or no symptoms at all, or frank symptoms. So this diagnostic approach gives us a lot of insight to problems many times before symptoms start to occur. That's it for today. I appreciate you joining me for the nutritional evaluation using laser diagnostics. This is Dr. Usry from All American Wellness.